You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for joining me in this week's episode. I'm going to be talking about oral cancer, the prevalence of it, the risk of it, what it is, what it does, and your dentist's role in helping to prevent and detect oral cancer and treatments of it. If you'd like to know more about holistic dentistry and the link between your mouth health and your overall health, then you can hop on over to either holisticdentistry.au or my dental practice website, evolvedental.com.au. If you'd like to see me as a patient here in Brisbane, you can give us a call on 0737 20 1811. But for now, let's get in the zone. Let's talk about oral cancer, the risk factors for it, what it means, how we diagnose it, the stages, treatments, prevention, and so much more. Now, understanding and preventing cancer has become a real priority in the healthcare world. And oral cancer is no exception, and it's a lot more common than many people think. This particular type of cancer is often overlooked, so learning the signs and the treatments and how to prevent oral cancer can actually be a real lifesaver. And one of the things and one of the roles we have as your dentist, as your oral health care provider, is to help check for, pick up the warning signs and detect and help treat cancers. But I think where we need to also look at is how we can cut down on the risk factors and how we can support people who have had oral cancer to have the best quality of life that they possibly can. So what is mouth cancer or oral cancer? Well, cancer is a growth of malignant abnormal cells which may spread throughout the body. Now, oral cancer can be found on the teeth or in the teeth. It can be on the lips, on the lining tissue of your lips and cheeks. It can be on the tongue, the roof of the mouth, both the hard and soft palate. It can be in your gums and on the floor of the mouth underneath the tongue. Now, oral cancer is a disease of the actual genes within the cells. These DNA, the genes disrupts normal cell division, and it creates malignant tumours that then invade the nearby tissues. Now, what triggers those genes is more important than the genes themselves, probably. So we have environmental factors that affect how those genes express. And they can trigger the onset of cancer. And this is where the field of epigenetics comes into place. And whilst each cancer is going to have a different set of conditions, the end result is the same. The cancer is an unwanted cell growth that can spread so rapidly to the other part of the body that it can create metastases, metastatic spread. And this is what then leads to ultimately death and terminal illness. Mouth cancer presents normally in the squamous cells, and these are the flat cells that line the lips, the oral cavity, and the tongue. Now, a white or a red patch on the mouth or lips can be an indicator of oral cancer if it lasts longer than a few weeks. So if you see something in your mouth, a good rule of thumb is if something resolves within 1 to 2 weeks, it's typically non-cancerous. If it's still there after the time, there is a risk that it can be cancer. You need to get it checked and you need to get it tested. Now, the problem with your mouth is there are a lot of areas that you can't see for yourself when you're looking in the mirror, and that becomes the dental professional's job to do an oral cancer check for you at every checkup. Now, if you're not going to the dentist and you're not having a checkup, then your risk of having an undiagnosed cancer in your mouth until it's quite advanced is high. So these squamous cell carcinomas refers to the cancer of the flat cells, and it accounts for up to about 90% of oral cancer cases, and they usually appear in the head as head and neck cancer. However, despite the singular name, these spots can have many different appearances. So a precancerous or squamous cell carcinoma can take on many, many colours. So I'm going to share with you what you can be looking for when you're looking in your mouth, and you should be looking in your mouth. You can get a little in-mouth mirror from the pharmacy and then just use a flashlight or a pen light type torch, or even the torch off your phone, to stand with that mirror, shining the light around, looking in your own mirror in the bathroom to check your mouth out. So what are the signs, the symptoms and the diagnostics of oral cancer? Well, what are the signs that appear and what should you do if you notice them? Well, there's several different patterns that indicate that a tumour is developing. The answer to what to do next is clear. You must call your dentist. No good actually going to your GP, because in most countries, and particularly here in Australia and in the UK where I grew up and trained, I have experience of this. Doctors are not trained in even what is normal anatomy in a mouth, yet alone what is abnormal. That's our job as dentists. So if you've got a lip or a mouth sore that isn't healing, like an ulcer that's been there for more than 2 weeks, you need to get that checked. If you've suddenly got loose teeth with no apparent cause, you've got lumps or growths inside your mouth, you're getting pain or difficulty when you're swallowing, you're getting ear or mouth pain, you've got a persistent sore throat, or you've got coloured patches inside your mouth that last more than 2 weeks. If you've got something that's ulcerated and bleeding and has been there for more than 2 weeks, you definitely need to get that checked. So when it comes to diagnosing oral cancer, we do a physical exam. So the doctor, in this case the dentist, will inspect for lumps, growths, and other issues in the mouth, tonsils, or lips. If there's a specific area that looks suspicious, then there's 2 ways we go forward. Here we will refer you to an oral pathologist, which is a medical trained dentist who is specialised in oral pathologies, so abnormalities of the mouth. If a suspicious area is found, then we may do a biopsy. So we remove some of the tissue and we send that to the lab where it can be tested for cancerous or precancerous cells. If the biopsy reveals the presence of these cells, then there will be further testing. But sometimes we can go straight to this testing where we'll do x-rays, a CT scan, like a 3D imagery. You may need an endoscopy where they put a small flexible camera in the throat down into the top part of the lung area, the oropharynx, to see if the cancer has spread. And this rules out throat cancers and also oropharyngeal cancers. Because the dental healthcare professionals are more familiar with diagnosing oral cancerous lesions, we are in a really good position to detect early signs of oral cancer before you notice them. And this is why your twice yearly checkups and teeth cleanings at the dentist are so important. It is not just your teeth and gums we're looking at. We're not just looking for decay. We're not just looking for gum disease. We're looking for abnormalities in your mouth. Every checkup I do starts, it's a 2-3 minute thing, and I check the inside of your lips, cheek, I check your tongue, roof of the mouth. I get you to poke your tongue to one side, lift your tongue up, poke your tongue up. I have a little look down the back of your throat. I have a feel around the outside to check if there's any swollen glands or lymph nodes. It takes 2 to 3 minutes, but that check could save your life. I then have a little device that looks like a flashlight that has a specific wavelength of light called an oral ID, and that helps me to have a look and shine that light on that area. And depending on how that area looks under that light with a special filter viewer, usually filter viewer glasses, that helps get it more of an idea of whether that area is an area of suspicion or not. And those twice yearly checkups and teeth cleanings may just save your life, literally. Not long after I'd graduated, my first job actually, I'd only been there a few months, I had a gentleman come in. He would have been in his late 50s, early 60s at that time. History of smoking and heavy drinking. Hadn't been the dentist in ages because he hadn't got many teeth left and he had dentures. And he came in because he was complaining that his denture no longer fit him. So I'm like, okay, this sounds like, just a case of a loose denture. Things shrink, change shape. Going to make him a new denture. Popped his denture out and he had this massive growth or lump in the floor of his mouth that was pushing the bottom of his mouth up like a big frog belly. And when I felt it, it was rock hard and I could feel no edge. Straight away, even as a young dentist, I'm like, oh no, that's cancer. And we got him under protest. We got him to go down to the dental hospital and see the specialist, and they did all the tests. And yes, it was a nasty cancer. He did have to have quite an extensive part of his jaw, his lower jaw removed, and part of the bottom of his mouth and tongue. But that trip to see me, it saved his life. I mean, I would go, we don't really save anyone's life because we'll pass away eventually. But in that moment, it stopped him being taken out by the cancer. And he had another, from what I know, another 15, 20 years of fairly good quality life. But I was thinking if it had come for regular checks, that could have been picked up before it had spread and done so much damage. So this is why, we're not just looking at your teeth and gums, guys. There's been studies that show links between multiple oral sexual partners and higher rates of oral cancer caused by the human papillomavirus, HPV. And we are seeing now mouth cancers in younger and younger patients. And because HPV-related oral cancer isn't easy to spot, signs must be found with a procedure called an endoscopy. So if you've had a large number of oral sexual partners, it's a good idea to talk to your dentist or your medical practitioner about having an endoscopy to rule out HPV in the throat or in the base of your tongue. Sorry, haven't got my notifications off. Do apologise. You don't want to wait to make these type of appointments, no matter how daunting the idea of an exam is. Early detection doubles your chances of successful cancer treatment in oral cavity cancer. So how do we identify oral cancer and pre-cancer? Well, coloured patches in the mouth can be the most noticeable sign that something is amiss. While these aren't definitive proof, they're not a definitive diagnosis, you must call your dentist if any of these occur or last more than 2 weeks. I'm going to cover some ways in which oral cancer may look when it presents as patches in the mouth. So you can have a mixture of red and white. So you get these red and white patches in your mouth called erythroleukoplakia. Erythro means red, leuko means white, and plakia means patch. So while they may not cause any discomfort, that does not rule out the possibility of it being cancer cells. If they're visible, then you should see your dentist if they last for more than 2 weeks. Then we've got red patches alone. So that's erythroplakia or a velvet textured red patch. These are usually pre-cancerous. Since 75 to 90% of these are cancerous, it's important you see your dentist right away. These red patches can occur under your tongue and can be inspected by gently looking underneath it after you've cleaned your hands thoroughly. You can grab hold of your tongue and lift it up. It does tend to fight, but have a look in the mirror. Then you've got white patches, leukoplakia or keratosis. This is a white or greyish patch in the mouth or lips. It can develop after exposure to carcinogens, so things like smoking and alcohol. They can develop from irritants like broken teeth or dentures that rub, tobacco usage, chewing on the lips or the lining of the mouth can also cause leukoplakia. Now, these white patches may not be cancerous, but they do indicate that the tissue could become problematic. Their appearance may change over time. They can become hardened and difficult to remove. And leukoplakia is typically slow growing over weeks or months, but it should also be checked. There are stages of mouth cancer. Mouth cancer, in fact, all cancers are categorized by 4 stages. This practice of cancer staging is crucial for assessing the treatment needed and the severity of the case. So stage 1, the tumour, patch or lesion is 2 centimetres or less in diameter and no cancer has spread to the nearby lymphatic nodes. Stage 2, the tumour is larger in size, measuring 2 to 4 centimetres and still no spread to the lymph nodes. Stage 3, 2 conditions can cause this classification. Either the tumour is bigger than 4 centimetres or is smaller and there's lymph node spread to 1 lymph node. The disease hasn't spread to further parts of the body in stage 3. Stage 4, the cancer has spread to other parts of the body, nearby tissues and more than 1 lymph node. More than half of cancer cases have spread by the time they are detected. So you must consult your dentist as soon as you can to avoid much more invasive treatment. So I'm going to give you some statistics. 95% of cases of oral cancer happen in people 40 years or older. I think it's here in Australia, between 8,000 to 10,000 cases of oral cancer are diagnosed every year. Sorry, notification's still going. I can't find the button to switch it off. So we'll just ignore the dings and bings. My apologies. 65% of the overall survival rate for oral cancer after 5 years. So if we can catch it early enough and treat it, 65% of patients will have a survival rate beyond 5 years. That jumps to an 84% survival rate if the cancer is caught in stage 1. Unfortunately, if the cancer is found in stages 3 to 4, then only 39% survive past 5 years. It's dreadful how quickly oral cancer will spread and how quickly it will take somebody out if not treated. So common symptoms: lip or mouth sores that aren't healing, loose teeth with no apparent cause, lumps or growths inside the mouth, pain or difficulty when swallowing, ear or mouth pain, persistent sore throat, or coloured patches inside the mouth that last for more than 2 weeks. Well, what are the risk factors for oral cancer? All tobacco use, smoking of any kind, tobacco chewing of any kind. Alcohol use, particularly heavy alcohol use, when you drink more than 8 drinks a week for women and 15 drinks a week for men. I still think that's very high alcohol consumption, and we can see that in lower alcohol. Too much sun exposure, so you can get sun damage to the lips, and that can trigger genetic changes that cause cancer. Human papillomavirus, the HPV, and weak immune system will predispose you for a risk factor. So we look at this, we go, what are the tips for prevention? How can we prevent cancer? Well, stop smoking or chewing tobacco, cut down on alcohol, use a SPF UV protection lip balm, Eat a healthy, alkaline, inflammatory diet, and never skip dental cleanings, and ask for cancer screenings if you believe you are at risk. So what are the treatments for oral cancer? Well, there's surgery. This is the most traditional and recommended treatment for patients with mouth cancer. Up to 50 to 60% of cases will be resolved with surgery alone, though the severity of the stage is going to determine what those treatment options are. So there's 3 types of common surgery. Remove the tumour. Simply cut away the cancerous area, small amount of tissue around it. This is generally the option for early stages. Later stage, you might have to have a larger area removed, which may include areas of your jawbone and parts of your tongue. You've got to remove cancer that has spread. So if it has spread into the throat or into the lymph nodes, then those areas need to be resected. The lymph nodes need to be dissected out to help prevent the cancer invading further into the body. Mouth reconstruction surgery. You may need to have your mouth rebuilt after removing the cancer. So this can include implants to replace the lost teeth, transplanted tissue to replace the skin or muscles of the tongue, bone, and rebuilding the lower lip. Reconstructive surgery prevents future difficulty with you being able to chew and speak. You may need radiation therapy, and this uses high-powered beams of energy to kill the cancer cells. This is most commonly done as a precautionary treatment after surgery, or it can be used as a standalone treatment in low-risk cases, but they've got to be extremely low risk. But unfortunately, radiation therapy can cause dry mouth, jawbone damage, and put you at risk of tooth decay. But each case is different, and the radiation therapy will be dependent on what you present with. Then there's chemo. Chemotherapy is the oral or intravenous mixture of drugs used to kill cancer. These can be used alone or combined with other cancer treatments, often used in conjunction with radiation therapy. And we know they do have side effects, including hair loss, vomiting, nausea, lassitude, low energy. You may be opted to go into a clinical trial for new drugs or cancer treatments, and we're going to work with your oncologist to determine what's the good fit for you. Keep in mind that these experimental therapies are going to have an unknown record for success, and you need to really talk about it at length and get the advice and support that you need. Then there's targeted therapy, and this generally refers to prescription drugs that attach themselves to the cancer cells and can stop them from spreading, halting the invasion of the cancer. That can be used alone or together with chemo or radiation therapy. Then there's immunotherapy. This is leveraging your body's natural cancer-fighting processes via the immune system, and you can sneak these products in through certain proteins. Immunotherapy will interfere with your defense mechanisms, and it will allow your body to fight off the cancer. And again, it's got to be tailor-made for you. We can look at nutrition. It's an important aspect of cancer treatment. Many patients with oral cancer experience weight loss, perhaps nausea after chemo, and they're going to have difficulty chewing. You need certain nutrients to fight off cancer and to deal with some of the side effects that you'll experience. So some of the things you want to look at are eliminating processed foods like processed meat, packaged foods, fast foods, anything that's burnt or fried, because they may contain a thing called acrylamide, which is a known carcinogen. You want to stay away from added and processed sugars. You want a high alkaline diet full of vegetables, antioxidants, and high fiber. You want to get into organic grass-fed meats instead of non-organic. You want to replace vegetable oils with your good, healthier fats like olive oil and avocado oil. Eat wild caught organic fish, and drink teas that are full of antioxidants. It's not proven to reverse cancer, but it will support your body's immunity and reduce the chronic inflammation. You may need to work with a nutritionist and dietitian to get the best sort of diet for you. Then I would look at detoxification. Your body often does a pretty good job of eliminating toxins that you're exposed to on a day-to-day basis. These include electromagnetic frequencies, EMFs, from electronic devices, ingredients in beauty products, chemicals, household cleaners. You'll be looking at getting rid of mercury from your amalgam fillings, plastics and chemicals. By altering your diet, you can support your body's normal detox program. But yeah, you want to kind of have a look at these things as well as cutting out alcohol and smoking. Then you need good dental hygiene. You boost your body's ability to conquer cancer with good oral health. Keeping your mouth moist can help your salivary glands to prevent decay, and keep your teeth and gums really clean can prevent further dental issues after treatment. You want to use in this case, this is where it kind of goes against all my stance on fluoride, but in these instances, you can use a prescription fluoride toothpaste, but I would prefer you use a high-strength hydroxyapatite toothpaste, and that's going to help deal with the sensitivity that a lot of patients that undergo chemo or radiation experience. Make your lifestyle changes that are going to boost the outcomes and the efficacy of your cancer treatments, and are going to help you cope with the fatigue. Walking 30 minutes a day can help you return let me just slow down. Walking 30 minutes a day helps patients return to daily life after cancer fatigue. Massage therapy can help reduce pain and anxiety. So you've got to make sure you're looking after yourself. So let's just summarize. Mouth cancer causes and risk factors. Many different factors can increase the likelihood of oral cancer. When genetic changes occur, the cells mutate, they grow, and they spread into tumours. There's not one single identifiable cause of oral cancer, but several risk factors make it more likely to occur. So tobacco use, smoking cigarettes, chewing tobacco, that really increases your odds of getting oral cancer. Heavy drinking, consistent and substantial alcohol heightens the likelihood of oral cancer. Too much sun, while this may not be obvious, getting that burning of your lips can cause lip cancer. HPV, the human papilloma virus, that is now responsible for 90% of all oral cancers that we have seen in recent years. A weak immune system, that's when your defenses are down and cancer can take hold more readily. Unfortunately, some of the treatments for cancer can cause complications, especially within the mouth. Radiation and chemo can cause bleeding, infection, pain, and what we call mucositis, which is inflammation of the mouth tissues. Radiation can also damage your salivary glands and create a dry mouth, or do damage to the neck and jaw muscles, which leads you to a condition where you can't open your mouth very well. This is called trismus. You can get bone damage in the oral cavity as well. Oral cancer is accompanied by increased risk for other cancers, including cancer of the stomach, liver, colon, thyroid, and esophagus. Lung cancer is also a concern, especially if oral cancer is related to smoking. A lot of cancer patients will feel depressed or end up with depression and anxiety, and I think that's understandable. Now, you can get mouth reconstruction and rehabilitation. You can have reconstruction if you've lost part of your tongue, teeth, oral cavity, and jawbone. This is oral reconstructive surgery, and often we'll borrow skin, muscle, or bone from other parts of the body to recreate a healthy mouth, and we'll use dental implants to replace teeth that are lost through cancer treatment, and artificial palates can be built in special cases. Even nerves can be transplanted if needed to allow for proper speech and swallowing. No matter what transplant or needed, they're going to borrow very carefully. They're going to take bone, tissue, muscle, skin and nerves from areas where their absence is not going to be noticeable. The rehabilitation can be quite extensive. After mouth reconstruction, you're going to need physical therapists, physiotherapists, speech pathologists, and your doctors will help determine what's best for you. As you recover, you might find that you're going to have 20, 30 rehab appointments in your first year. And as I said, a speech pathologist is quite necessary as an occupational therapist. And like, oral cancer is awful. It's a painful experience, but you don't have to go through it on your own. Now, how to prevent it? There's really effective ways to prevent it, and it's quitting. Say goodbye to alcohol use, quit tobacco, and it's going to benefit your general health, but it greatly decreases your odds of oral cancer. If you do continue to drink, try and limit it to no more than 1 drink a day, and avoid all forms of smoking. Avoid smokeless tobacco. That can give you lip cancer. I would also say vaping now. That's something that we need to consider. We don't really understand the implications, but I do believe it's carcinogenic. You've got to protect your face, your lips from sun exposure. You can do a large brim hat, sun cream, lip balm with SPF. And you can eat fruits and vegetables, load up on your antioxidants and detox your system. So you need dental visits, self-exams and screening. Oral cancer prevention gives you another reason to stop avoiding us as your dentist. You need your regular dental checks every 6 months. You can help your dentist catch oral cancer before you can. If you have one or more of the risk factors for oral cancer, you should definitely be going and having an oral screening. We can check for tumours, lesions, patches, and any other areas of concern. We can order additional tests to investigate the possibility of cancer. Remember, 90% of oral cancers have spread before they are detected. Don't be afraid to mention your concerns to the dentist. Though there's no available data on oral cancer screening saving lives, awareness is important. You can do self-exams at home. They're never a substitute for us because you don't really know what you're looking for. And like I said, you can use a light to examine for patches on the gums and the roof and the sides of the mouth, and check under your tongue. If you have a suspicious lump, a sore spot or a patch that's been there for more than 2 weeks, get it investigated and book a dental appointment to get it checked. There are support groups for people living with oral cancer. You can reach out and connect to them. There's mouth cancer foundations, and we're definitely trying to raise people's awareness around this. And we have Mouth Cancer Month or Mouth Cancer Week, and we talk about this more regularly. So I want you to, really be aware of this. So I'm just going to summarize. The survival rate for mouth cancer depends on the stage of which it is caught. The overall 5-year survival rate is around 65%. For those who catch it in stage 1 or 2 with no cancer spreading to the lymph nodes, then the 5-year survival rate jumps to 80% plus. Once it's spread, however, it drops to below 40%. This is why it's so essential we catch it early. How fast does oral cancer spread? Well, no 2 cases are exactly the same, but oral cancer can spread into your heart, your spine, your kidneys, and most oral cancer cases, because they're not detected until they have moved beyond the mouth, it's super important that you visit your dentist if you do notice any potential signs. Don't wait till it's too late. So, oral cancer can affect your lips, tonsils, gums, the mouth's lining, the floor of the mouth and the tongue. Symptoms can include any of the following: where you get ear, mouth or swallowing pains, lips and mouth sores, discoloured patches, unexplained loose teeth and sore throats. Oral cancer severity is gauged by its size and its spread. Treatment involves surgery, radiation and chemo and lifestyle changes. Heavy drinking, tobacco, sun exposure and HPV are your greatest risk factors for lip and mouth cancer. And if these factors do apply to you, you should be definitely having your twice yearly dental visits and discuss oral cancer screening with your dentist. If you do have oral cancer, it can be treated, it can be rehabilitated. So thank you very much for joining me. This is the Dental Zone. This may have been quite a heavy topic today, but it's one that most people don't know about, they don't talk about, they don't have enough awareness around. And because we are seeing increased prevalence of mouth cancers at younger and younger ages, we want to pick these things up early, and prevention is key. Early diagnosis is key. So thank you for joining me. I'm Dr. Rachel Hall. I'm a holistic dentist in Brisbane, Australia. Check me out, holisticdentistry.au or evolvedental.com.au. Give us a call if you want to make an appointment, 0737 20 1811. Do tell people about the podcast. Share it on your social media. If you're listening on Apple Podcasts, then leave us a review. If you're listening to this on YouTube, leave us a comment, give us a like, subscribe to the channel. Let's get this podcast out there. Let's get people in the dental zone and finding out about the link between mouth health and their overall health. Until next time, guys, thank you so much. It's been a blast. Stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.